Recognize Congressman Foster for your questions.
Thank you. As a scientist, I am really proud of the work that researchers have done to develop and test vaccines to provide protection against this virus. In the early days of the pandemic, Congresswoman Donna Shalala, the former head of HHS, and I led a bipartisan letter urging maximum resources to be put into all vaccine manufacturers that had any chance of making a workable vaccine. This effort was eventually rebranded as Operation Warp Speed. On the Coronavirus Oversight Committee that we're convening here, we have been very active in overseeing that production effort and also making sure that when the first doses were available, they were equitably distributed, which was not naturally going to happen. And so I'm very grateful of the work of the federal, state, and local officials, as well as the healthcare providers and other community members who have helped get the first millions of shots in arms in record time. And now with 423 million doses of coronavirus vaccines administered in the U.S. to date, we have seen that the vaccines are very safe and effective. The data shows that the vaccines are literally lifesavers and that serious side effects are rare. And yet, far too many Americans are still placing their lives and the lives of others at risk because of vaccine hesitancy. So, Dr. Ezike, as a physician, what are the first arguments that you find most effective when you recommend that people get vaccinated or boosted as soon as they're eligible?
I continue to share the information about how layered approaches are important and how prevention is always our first line. I think I try to use the examples of vaccine preventable illnesses that we don't see. I've been a physician for over 20 years. I've not treated one case of measles. But I do have my tennis captain, her brother is deaf from the results of measles. And so in that short time, we can see what the vaccine has done. The example of polio, I don't have children jumping double Dutch jump rope with braces on their legs from polio. The only reason that we don't have polio is because of the vaccine. So just reminding and level setting about what vaccines are. I know a big pushback that comes back is when we talk about the Tuskegee. In the African American community, we talk a lot about, the Tuskegee experiment where public health officials did not do right by people of color. And so you even use understanding that example, acknowledging that something was done very wrong during that time, but remembering that in the Tuskegee, in that instance, we had a situation where treatment was withheld. There was available antibiotics that were withheld from people who needed it. And in this case, we have that available treatment that we don't want to withhold from people of color or anyone else.
Yeah, you're right. That will just compound the inequity that's been longstanding in our healthcare system. Actually, you did a good job of answering my next question. Mayor Lightfoot, are there other aspects of your city's approach that have helped convince Chicagoans that vaccines are safe and effective? You've not had a chance to mention yet.
Yeah. I think, look, at the very beginning, it was just getting out the basic information about the various clinical trials, the results of the effectiveness of it. That really, I think, helped allay a lot of concerns initially. But right now, where we are, there's not one size fits all approach. You've got to simply start the conversation by listening and really getting an understanding of what the particular person's hesitancy is. It's that simple, but that complicated. And then look, we've got all the data that you want. For example, in our city, if you're a person of color, 50 years or older, you've got a 50 times more likelihood of death if you're unvaccinated. When you start talking to people one-on-one about those kinds of shocking statistics, that catches their attention. But what we also try to do is draw out the misinformation that they've taken in so that we can disabuse them with the facts. But it really requires a lot of patience, a lot of listening to go directly, and that's a lot of what the vaccine ambassadors work that they're doing on a regular basis. And that's why I'm proud of that program, and I think it's been wildly successful in bringing communities into care. The other thing that we're really avoiding doing is shaming people in communities for not being vaccinated. So we're trying to reinforce the Protect Chicago 77 with positive messaging. Anytime a community makes measurable progress, we highlight that on various social media platforms, and I think that positive reinforcement is also helping considerably.
Thank you. I have now 5 seconds left, so I think I will yield back.
Thank you, Congressman. We're going to do one more round of questions. So, Mayor, as you were talking, one thing that dawned on me is when you have almost 80% of Chicago residents now having a shot, that has to touch almost every city. At least that's what I'm assuming. Now, let me ask you this. This may be a loaded question, but do you find that family members are good ambassadors to other family members? Because I hear both anecdotes both ways.
It really does go both ways, but if we can reach someone in that family and then get them to be ambassador with their own family, to talk to mom, dad, grandma, other siblings, it does make a huge world of difference. That's why I think in part our initial push, Protect Chicago Plus, was so successful. We really concentrated on getting someone, particularly within intergenerational households, who would be the messenger on the vaccine, who would bring the reluctant family members to a vaccination site. That's what I think made very successful. For example, the Belmont-Cragen neighborhood through most of 2020, before there was a vaccine, was a neighborhood where we saw exploding case rates, percent positivities in the high teens or even higher in some instances. That community now is one of the most vaccinated in our city because of the hard work that was done through Protect Chicago Plus, working with trusted stakeholders. And we held a lot of vaccination opportunities all over, in schools, in faith houses of worship. You name it, we were there working with our partners in various pharmacies, various doctors that were from that neighborhood. That neighborhood has had a remarkable recovery because of the hard work that was done prior to the time that we got vaccine, and then pushing it out and then highlighting those local stakeholders who said, yes, I got the vaccine, and here's the reason why.
Thank you.